Hey everyone, welcome back. It's Harvey here,
Hey.
and with me is Donna.
Hi, everyone.
We're both MCCQE reviewers, and we're both really passionate about helping you
Yes.
conquer this MCCQE.
Yeah, conquer this beast of an exam.
Oh, it's a beast.
It is the beast.
You got it. It is a beast. So we know how overwhelming prepping for the MCCQE can be.
Oh, absolutely.
So we're breaking down
Yeah.
the major concepts.
We're going to be using solid resources like stat pearls
Yeah, that's good stuff.
to try to break it down and make it all a little less scary.
Make it all a little less scary for sure. And just a real quick reminder before we dive in.
Yes.
This is for educational purposes only.
Right.
This is not medical advice.
Not medical advice.
Always consult a qualified healthcare provider for any health concerns.
Absolutely.
Okay, with that out of the way, today's deep dive
Yes.
is lung cancer,
Lung cancer.
a topic that is almost guaranteed to pop up
Oh,
on
yeah.
the MCCQE.
For sure.
Right.
It's definitely high yield and
It's like,
for good reason. Lung cancer is a huge global health challenge with
Yeah.
shocking statistics, you know?
Mhm.
Think about this. Since 1987, it's been the leading cause of cancer death in women,
Really?
surpassing even breast cancer.
Wow. That's a serious wake-up call.
It is. In the U.S. alone, we see about 225,000 new cases annually, with about 160,000 deaths.
Wow.
And globally, it's the most diagnosed cancer overall.
Really, it's amazing how much the landscape has changed, right?
Yeah.
I mean, lung cancer was relatively rare in the early 1900s, but then
Wow.
smoking took off and, yeah,
And then those numbers just skyrocketed.
skyrocketed, yeah.
Which brings us to etiology, the root of the problem.
Yeah.
While everyone knows that smoking is the biggest culprit, accounting for like 90% of cases, especially in men,
Right.
it's not as simple as just counting packs per year.
Okay, so there's more to the story than just how much someone smoked.
Absolutely. Lung cancer risk is like this tangled web of genetics, environmental factors, and lifestyle choices.
So what are some of the less obvious threads in this web? Besides smoking, of course.
Well, even passive smoking ups your risk by 20 to 30%.
Wow.
And exposure to certain carcinogens like asbestos, especially in certain occupations, is a major factor. The more you're exposed, the
Nice.
higher that risk climbs.
Asbestos is definitely a red flag. And radon, too, right?
Uh-huh.
I feel like that's
Radon's another big one.
everywhere these days.
Especially for smokers.
Yeah.
It's this radioactive gas found naturally in soil and rock.
Right.
And it can actually seep into homes and build up to dangerous levels.
So even our homes can pose a threat.
It is, and the list goes on. Certain metals like chromium and nickel are linked to lung cancer,
Right.
and even some lung diseases like idiopathic pulmonary fibrosis can independently increase your risk, regardless of smoking history.
So it's a multi-headed beast.
Yeah,
This is starting to feel
it is complex.
pretty complex.
But to really understand lung cancer, we need to zoom in to the cellular level, to the pathophysiology, that story of what's happening in the cells themselves.
Okay, let's get microscopic here. What's going on at that level?
Think of it this way. Repeated exposure to those carcinogens we talked about,
Right.
like cigarette smoke or asbestos, causes the cells lining your airways to become abnormal, a process called dysplasia.
So they're kind of messed up from the start.
Exactly. And over time, these abnormal cells accumulate genetic mutations, like changes in their DNA.
Okay, so their blueprints get corrupted. What happens then?
These mutations disrupt the normal cell cycle, the carefully controlled process of cell growth and division, and eventually this leads to uncontrolled cell growth, which is essentially what cancer is.
So it's like a domino effect from damaged cells to genetic mutations to out-of-control growth.
That's a great way to put it. And the specific mutations involved can vary depending on the type of lung cancer.
Right.
For example, in small cell lung cancer,
Or SCLC.
it's CLC, exactly.
Yeah.
You often see mutations in genes like MYC, BCL2, and P53.
Those are some serious-sounding genes.
They are. They're key players in cell regulation.
Right.
While in non-small cell lung cancer, or NSCLC, which is more common,
Yeah.
mutations in EGFR, KRAS, and P16 are more frequent.
Okay, lots of acronyms to keep track of.
I know, right? But the good news is we have a system to help us navigate this alphabet soup.
I was going to say.
The 2021 WHO classification.
Ah, yes, the Rosetta Stone of lung cancer.
Exactly. This classification system helps us categorize lung cancers based on their cellular and molecular characteristics. And
Yeah.
it's absolutely crucial because it guides how we diagnose and manage the disease.
So what are some of the broad categories in this classification system?
It covers a wide range,
Yeah.
from precursor lesions, which are early changes that can sometimes progress to cancer,
Uh,
to full-blown cancers like adenocarcinoma, squamous cell carcinoma,
right.
and small cell carcinoma.
Wow, that's quite a spectrum.
hmm
Can you give us a specific example of why this classification matters so much?
Sure, let's take adenocarcinoma, which is the most common type of lung cancer. Within adenocarcinoma, there are even subtypes like acinar, papillary, and solid, each with its own set of features and its own story to tell about how aggressive the cancer might be.
So depending on the specific subtype,
Uh-huh.
the outlook for the patient might be different.
Precisely. Knowing the exact subtype helps us tailor the treatment plan and give patients a more accurate understanding of their prognosis.
Okay, so it's all about precision, getting the right diagnosis to guide the right treatment.
Exactly. Now, let's talk about how lung cancer actually shows up, how it presents in patients.
Okay, here come the clinical mysteries.
Yeah.
What are the red flags that we should be on the lookout for?
The challenge is that lung cancer doesn't have one specific symptom.
Right.
And to make things even more complicated, many patients don't even show up until the disease is already advanced.
That makes early detection even more critical, right?
Absolutely. But recognizing those early signs can be tough.
Yeah.
While cough is the most common symptom, it can also be a sign of many other less serious conditions.
So a cough alone isn't enough to raise alarm bells.
Right.
But what kind of cough?
But even the type of cough can offer clues.
Okay.
For example, a persistent cough that produces a lot of mucus, especially if it's thin and watery, could be a sign of mucinous adenocarcinoma.
So we need to pay attention to those details. What else should we be looking out for?
Hemoptysis.
Coughing up blood.
Coughing up blood is definitely a red flag, although it can be caused by other conditions too.
Right.
Chest pain and shortness of breath are also common,
Yeah.
but again, they're not specific to lung cancer.
So we have to be real detectives here, looking for patterns and considering the whole picture.
Uh-huh.
Are there any presentations that are especially tricky to diagnose?
Oh, absolutely.
Hmm?
One is pleural involvement. Malignant pleural effusions, which is when fluid builds up around the lungs due to cancer,
Yeah.
can mimic benign effusions, making a careful diagnosis crucial.
So we can't just assume it's harmless fluid.
Right.
What if...
Paraneoplastic syndromes are another tough one. These are syndromes caused by the tumor-releasing hormones or other substances that affect distant organs, essentially messing with the body's normal functions.
Whoa. The tumor can have far-reaching effects.
Yes, it can. For instance, hypercalcemia, an excess of calcium in the blood,
Right.
can be a sign of lung cancer, often linked to the tumor secreting a hormone called PTHrP or to bone metastases.
So it's like the tumor's a puppet master pulling strings throughout the body.
That's a great analogy.
Yeah.
And the MCCQE loves to throw in these challenging presentations, so be prepared to think critically and differentiate lung cancer from other conditions.
Okay, so we've got this complex disease with a range of presentations, some more obvious than others.
Right.
What's the next step in evaluating a patient with suspected lung cancer?
Staging.
Staging, okay.
Accurate staging is absolutely essential because it dictates the treatment plan
Right.
and helps us understand the patient's prognosis.
Right. Staging is like figuring out how far the enemy has advanced. So how do we go about staging lung cancer?
It's a multi-step journey. We start with imaging to visualize what's happening in the chest, typically with CT scans and PT scans.
Okay, what kind of intel do these scans give us?
A CT scan provides a detailed anatomical roadmap showing the location and size of the tumor and whether it has spread to nearby lymph nodes.
It's like getting a blueprint of the battlefield.
Exactly. And a PET scan goes a step further, showing us which areas are metabolically active,
Okay.
which can help distinguish between benign and malignant lesions.
So they work together to give us a more complete picture.
Right.
But are these scans enough for staging?
While they're incredibly valuable, they don't tell us the whole story.
Oh.
We still need a tissue diagnosis to confirm the type of lung cancer and determine the best treatment approach.
So we need to go deeper, literally.
Right. That's where invasive staging techniques come into play.
Okay.
And there's a whole arsenal of tools we can use, each with its own strengths and limitations.
Okay, let's talk tools. Which ones should we be familiar with for the MCCQE?
For peripheral lesions, those located further out in the lungs, a CT-guided biopsy is often the preferred approach.
Okay.
It's relatively safe and effective,
Yeah.
but it does carry a small risk of pneumothorax.
A collapsed lung.
A collapsed lung, yeah.
So it's a balance between getting the sample we need and minimizing risk to the patient.
Exactly. And for lesions closer to the center of the chest,
Okay.
we might use bronchoscopy,
Okay.
a procedure where a thin, flexible tube is inserted through the mouth or nose and into the airways.
I've heard of bronchoscopy, but how does it help with staging?
Well, there are different types of bronchoscopy that
Yeah.
allow us to visualize and biopsy lymph nodes and tumors in the airways and surrounding areas.
Okay.
For example, EBUS,
Endobronchial ultrasound.
endobronchial ultrasound, uses ultrasound technology to guide the biopsy needle.
So it's like a tiny ultrasound probe on the end of the bronchoscope.
Precisely. And there are two main types of EBUS. CP EBUS, which uses a convex probe to visualize and biopsy lymph nodes through the bronchial wall, and RP EBUS, which uses a radial probe to reach more peripheral lesions.
Okay, so we have CP-EBUS for central lesions and RP-EBUS for more peripheral ones. Why do we need both?
They target different lymph node stations, those clusters of lymph nodes that drain specific areas of the lungs. CPEBUS is great for accessing stations like 10, 11, and 12, which are in the Heller region where the bronchi enter the lungs.
So it's like having different keys to unlock different doors.
Exactly.
Yeah.
And RPEBUS can access more peripheral stations, giving us a 360-degree view of the airways, but it doesn't have the real-time biopsy capability of CPEBUS.
So they each have their strengths.
Yeah.
Are there any other bronchoscopic techniques we should know about?
Definitely. Endoscopic TBNA.
Endoscopic transbronchial needle aspiration.
Endoscopic transbronchial needle aspiration
Yeah.
allows us to sample lymph nodes through the esophageal wall,
Wow.
reaching stations like 2, 4, and 7,
Okay.
which are in the mediastinum.
So it's another tool in our arsenal for accessing those critical mediastinal lymph nodes.
Right, and for cases where we need a more extensive evaluation of the mediastinum,
Okay.
we might turn to mediastoscopy.
Mediastinoscopy.
Yes.
Isn't that a bit more invasive?
It is, but it allows us to directly visualize and biopsy lymph nodes in the mediastinum, especially when other techniques are inconclusive.
So it's like the big guns for mediastinal staging.
Exactly. And finally, we have VATS.
Video-assisted thoracoscopic surgery.
VU-assisted thoracoscopic surgery, which is a minimally invasive technique that allows for both lymph node sampling and full dissection.
So it's like a hybrid approach combining diagnosis and treatment in one procedure.
Precisely. VTS has become increasingly popular for staging lung cancer because it's less invasive than traditional open surgery, but still provides valuable information.
Wow, we've covered a lot of ground at just talking about staging techniques.
I know, right?
It's clear that accurately determining this stage of lung cancer is crucial for guiding treatment and predicting prognosis. So now that we have a better understanding of how we stage lung cancer, what's the next critical step?
Treatment and management.
All right, let's talk treatment.
Okay.
I know the approach can vary dramatically depending on the type and stage of the cancer.
Absolutely.
Yeah.
We'll focus on the two main categories: non-small cell lung cancer, or NSCLC, and small cell lung cancer, or SCLC.
Sounds good.
Yeah.
Let's start with NSCLC.
Okay.
What are the key treatment strategies for each stage?
For early stage, NSCLC stages I and II, where the cancer is still relatively localized, surgery is the gold standard.
Oh.
The goal is to remove the entire tumor along with a margin of healthy tissue to reduce the risk of recurrence.
So we're aiming for a complete resection, taking out all the bad stuff. What types of surgery are typically performed for NSCLC?
The type of surgery depends on the size and location of the tumor,
Right.
as well as the patient's overall health and lung function. For smaller tumors, a lobectomy, where an entire lobe of the lung is removed, might be sufficient.
It's like trimming a branch off a tree.
Exactly, but for larger tumors, or tumors that are closer to vital structures, a pneumonectomy, where the entire lung is removed,
Wow.
might be necessary.
That's a major surgery.
It is, but thankfully surgical techniques have advanced significantly, and minimally invasive approaches like VATS are becoming increasingly common.
Right. VATS allows surgeons to perform these complex procedures through smaller incisions,
Right.
leading to faster recovery times and fewer complications.
Exactly. And for some patients with stage 2 NSCLC, adjuvant chemotherapy might be recommended after surgery to further reduce the risk of recurrence.
Okay, so it's like an insurance policy just in case any stray cancer cells are still lurking around.
That's a good way to think about it.
Yeah.
Now, moving on to stage 3 NSCLC, things get a bit more complicated.
Okay.
It's a heterogeneous group,
Right.
meaning there's a range of tumor sizes and lymph node involvement,
Right.
which can significantly impact treatment decisions.
So there's no one-size-fits-all approach for stage 3.
That's right. Treatment is often individualized, taking into account the specific characteristics of the tumor and the patient's overall health.
Okay, so what are some of the treatment options for stage 3 and SCLC?
For some patients with stage IA where the cancer is more localized, surgery might still be an option, often followed by adjuvant chemotherapy or chemoradiotherapy.
So surgery isn't entirely off the table for stage 3.
Not necessarily,
Okay.
but it depends on the extent of the disease.
Right.
For patients with more extensive lymph node involvement or tumors that are close to vital structures,
Right.
surgery might not be feasible.
Okay, so what are the alternatives for those patients?
For those who aren't surgical candidates, the standard treatment is concurrent chemoradiotherapy.
Right, where chemotherapy and radiation therapy are given simultaneously.
Exactly.
Right, we talked about that earlier. A more aggressive approach, but it can also be quite toxic.
Yes. Concurrent chemoradiotherapy can have significant side effects. So it's a decision that should be made carefully, weighing the potential benefits against the risks.
Okay, so it's about finding the right balance.
Right.
Now, what about stages IA, B, and 4?
Okay.
How are those treated?
Stages IB and 4 are considered advanced stages, meaning the cancer has spread beyond the lung, either to nearby structures or to distant organs.
Right.
Unfortunately, these stages are not considered curable.
Right.
So the goal of treatment often shifts to palliative care,
Okay.
focusing on symptom management and improving quality of life.
That must be incredibly difficult for patients and their families to hear.
It is, but palliative care doesn't mean giving up.
Right.
It's about providing comprehensive support and focusing on what matters most to the patient.
So it's about shifting from a cure-focused approach to a comfort-focused approach.
Exactly. And even though these stages are advanced,
Yeah.
there are still treatment options available.
So what are some of the treatments used for advanced NSCLC?
Chemotherapy can still be effective in shrinking tumors, controlling symptoms, and improving survival.
Okay, so chemotherapy is still an important weapon in our arsenal. But are there any other options?
Yes. Okay. And this is where things get really exciting.
I like exciting.
In recent years, there have been remarkable advances in targeted therapies and immunotherapy for NSCLC.
Right.
And these treatments are truly transforming cancer care.
We talked briefly about those earlier. Can you remind us how they work?
Targeted therapies are like smart bombs.
No.
They zero in on specific molecules or pathways involved in cancer growth, essentially blocking the signals that tell cancer cells to multiply.
So it's like cutting off the fuel supply to the cancer cells.
Exactly. And immunotherapy takes a different approach. It harnesses the power of the body's own immune system to recognize and destroy cancer cells.
That's incredible. So these new treatments offer real hope for patients with advanced NSCLCs.
Absolutely.
Yeah.
They're providing better outcomes, often with fewer side effects than traditional chemotherapy.
Right.
And it's a rapidly evolving field with new discoveries and breakthroughs happening all the time.
This is truly groundbreaking stuff.
Yeah.
Now, let's shift gears and talk about SCLC. How does the treatment approach differ for this type of lung cancer?
SCLC is a very aggressive cancer,
Right.
but it's also highly sensitive to chemotherapy.
Okay.
The downside, however, is that it tends to come back quickly.
So it's a bit of a two-sided coin. How do we approach treatment based on stage?
As we mentioned before, SCLC is usually categorized as either limited stage or extensive stage.
Okay.
For limited stage SCLC, where the cancer is confined to one side of the chest,
Right.
the standard approach is a combination of chemotherapy and radiation therapy.
Okay. Why both chemotherapy and radiation?
Chemotherapy attacks cancer cells throughout the body, while radiation therapy targets the tumor directly, shrinking it and reducing the risk of local recurrence.
So it's a 1-2 punch.
Exactly. And in some cases, for very early stage, limited SCLC surgery might even be an option, followed by adjuvant chemotherapy and radiation therapy.
Okay, so there's a range of options for limited stage SCLC. What about extensive stage SCLC?
Extensive stage SCLC, where the cancer has spread beyond one side of the chest, is more challenging to treat.
Right.
Chemotherapy is still the primary weapon, but the goal is often palliative, focusing on symptom control and extending survival rather than aiming for a cure.
So for extensive stage SCLC, the prognosis is not as good.
Unfortunately, that's true. The survival rates for extensive stage SCLC are significantly lower than for limited stage,
Right.
which highlights the importance of early detection and prompt treatment.
This is a lot to take in, but it's incredibly important to understand these different treatment approaches and how they relate to the stage and type of lung cancer.
Absolutely. And remember, we're just scratching the surface here.
Right.
Lung cancer treatment is a complex and constantly evolving field,
Yeah.
and each patient's case is unique.
Right. It's about tailoring the treatment plan to the individual, considering their specific needs and circumstances. And before we move on, I want to touch on something that's often overlooked, but is incredibly important.
What's that?
The psychosocial impact of a lung cancer diagnosis.
That's such a crucial point. A lung cancer diagnosis can be completely overwhelming.
Yeah.
Not just for the patient, but also for their families and loved ones.
It's a life-altering event that can trigger a whirlwind of emotions, fear, anxiety,
Right.
anger, sadness. It's a lot to process.
Absolutely. And it's essential to address these emotional and psychological needs alongside the physical aspects of the disease.
So it's about providing holistic care, supporting the whole person, not just treating the disease.
Precisely. Patients with lung cancer often need help coping with the diagnosis, managing treatment side effects, navigating the complex healthcare system, and making difficult decisions.
And that's where a strong interdisciplinary team is so valuable, right?
Absolutely. Oncologists, nurses, social workers, psychologists,
Yeah.
palliative care specialists, they all play a vital role in providing comprehensive care and support to patients and their families.
It's like creating a safety net, a circle of support for the patient and their loved ones.
Exactly. And it's about recognizing that the psychosocial impact of lung cancer can be just as profound
Absolutely.
as the physical challenges.
Donna, this has been an incredibly insightful deep dive into the world of lung cancer.
It has.
We've covered so much ground,
So much.
from epidemiology and pathophysiology to diagnosis, staging, treatment,
Yes.
and the psychosocial aspects of the disease.
Absolutely.
I'm exhausted.
It's been a pleasure unpacking all this information with you, Harvey.
Oh, likewise.
And I hope our listeners are feeling more confident in their understanding of lung cancer,
Absolutely.
especially as they prepare for the MCCQE.
Absolutely. But before we move on to the next section,
Okay.
I want to reiterate a crucial point.
Of course, what is it? Remember, everyone, this is all about education, not medical advice.
Right.
We're giving you the tools to ace the MCCQE. Yeah.
Not to replace the expertise of qualified healthcare providers.
Right.
Always consult a doctor or other healthcare provider if you have health concerns.
Well said. Now I think it's time to circle back to staging,
Okay.
because we know it's crucial for determining the right treatment path for lung cancer.
Absolutely. And I want to delve a little deeper into the N category of the TNM staging system, which describes lymph node involvement.
Okay.
Specifically, we touched on N2 nodes earlier, those located in the mediastinum.
Right. You mentioned that N2 nodes are particularly important. Can you explain why?
Well, they often signal a turning point in treatment decisions.
Okay.
If N2 nodes are involved, it suggests a higher likelihood that the cancer has spread beyond the initial tumor.
Right.
This usually means surgery alone might not be enough, and we might need to consider more systemic approaches like chemotherapy and radiation.
So it's a bit of a game changer in how we approach the case.
Exactly.
Yeah.
Accurately assessing N2 node involvement is key for both prognosis and treatment planning. Okay, so tell me more about these N2 nodes.
Okay.
Where exactly are they, and how do we figure out if they're involved?
N2 nodes are tucked away in the mediastinum,
Right.
that central compartment in your chest that houses the heart, major blood vessels, trachea, and esophagus.
So it's a pretty crowded neighborhood.
It is.
Yeah.
And because of this complex anatomy, accurately assessing N2 nodes can be challenging,
Right.
but it's crucial to get it right because it can drastically change the treatment plan.
That's where those invasive staging techniques we talked about earlier come in, right?
Yes.
Like EBUS and mediastinoscopy.
You got it. Those techniques allow us to get a direct look at the mediastinal lymph nodes and take samples for biopsy.
Right.
They're essential for accurate staging when it comes to N2 nodes.
So we're basically using these tools to create a map of how far the cancer has spread.
Precisely.
Yeah.
And that map guides our treatment strategy.
Okay, this is all starting to click now.
Good.
We talked about the TNM staging system being used mainly for NSCLC.
Yes.
How do we stage SCLC?
SCLC staging is a bit more straightforward.
Okay.
Instead of the detailed TNM system, we categorize SCLC as either limited stage or extensive stage.
Okay, remind me again what those terms mean.
Limited stage means the cancer is confined to one side of the chest
Okay.
and can realistically be treated with radiation.
So it's still localized, hasn't jumped ship yet?
Right, well, extensive stage means the cancer has spread beyond one side of the chest,
Right.
often involving distant organs.
Okay, that makes sense. And this distinction between limited and extensive has big implications for treatment and how we talk to patients about their prognosis.
Absolutely.
Speaking of prognosis, I know lung cancer sadly has a high mortality rate.
Yes.
What factors play a role in a patient's outlook?
It's definitely a complex issue influenced by a lot of variables.
Right.
The type and stage of the cancer, the patient's overall health,
Right.
and the presence of certain molecular markers all come into play.
So it's not just about the stage of the cancer. You need to look at the whole picture.
Absolutely. While stage is the most important factor for both NSCLC and SCLC, someone in relatively good health who can tolerate treatment well is likely to have a better outcome than someone who is frail or has other health problems.
Right. So it's not just about fighting the cancer, but also about the patient's resilience and ability to withstand treatment.
Exactly. And we also need to consider these molecular markers,
Yeah.
which can tell us a lot about how the cancer is likely to behave. For example, in NSCLC, the presence of EGFR mutations often means the cancer will respond better to targeted therapies, and the patient might have a more favorable prognosis.
So these molecular markers are like clues that help us personalize treatment
Yes.
and make more informed predictions about how the cancer might progress.
Precisely. They're becoming increasingly important in oncology.
Okay.
Now, with all that in mind, let's dive into the various treatment options for lung cancer,
Right.
starting with NSCLC.
Okay, let's break it down. What's the go-to approach for early stage NSCLC?
For stages I and II where the cancer hasn't spread much, surgery is typically the first line of treatment.
Okay.
The aim is to completely remove the tumor, taking a margin of healthy tissue to minimize the chance of it coming back.
So a clean sweep, removing all the cancerous cells if possible. What types of surgery are commonly performed?
It depends on the tumor size, location, and the patient's overall lung function.
Right.
For smaller tumors, a lobectomy, removing a lobe of the lung, might be all that's needed.
It's like removing a section of an orange.
Exactly.
Yeah.
But for larger tumors or those near vital structures, a pneumonectomy, removing the entire lung, might be necessary.
That sounds intense.
It is a major surgery, but techniques have advanced significantly.
Right.
Minimally invasive approaches like VATs are becoming the norm.
Right. VATS allows surgeons to operate through smaller incisions, which means less pain and faster recovery for the patient.
Exactly. And for some patients with stage 2 NSCLC, adjuvant therapy, like chemotherapy, might be recommended after surgery to further reduce the risk of recurrence.
So it's like adding an extra layer of protection.
Precisely. It helps ensure that we've eliminated any lingering cancer cells.
Right.
Now, when we get to stage 3 NSCLC, the treatment landscape becomes a bit more complex.
Right. You mentioned stage 3 is a bit of a mixed bag.
Yeah.
With a range of tumor sizes and lymph node involvement.
Exactly. Treatment decisions have to be made on a case-by-case basis, taking into account the unique features of each patient's cancer.
So what are some of the treatment options for stage 3 NSCLC?
For some stage 3 patients, those with more localized disease, surgery might still be an option, often followed by adjuvant therapy, like chemotherapy or chemoradiotherapy.
So surgery is still a possibility? But it depends on how much the cancer has spread.
Exactly. For patients with more extensive lymph node involvement or tumors that are difficult to remove surgically, the standard treatment is concurrent chemoradiotherapy.
Right, that's where we hit the cancer with both chemotherapy and radiation at the same time.
Precisely. It's been shown to be more effective than sequential therapy in this setting.
Right.
But it's important to remember that concurrent chemoradiotherapy can have significant side effects.
So it's a powerful weapon.
Yes.
But we have to use it carefully, considering the potential benefits and risks.
Absolutely.
Yeah.
Now, when we move on to stages IAB and 4 NSCLC, we're talking about advanced disease,
Right.
where the cancer has spread beyond the lung.
And at this point, the focus shifts to palliative care, right?
Yes. Unfortunately, stages IB and 4 are not considered curable, so the primary goal becomes providing comfort, managing symptoms, and improving quality of life.
That must be such a difficult transition for patients and their families,
Yeah.
going from hoping for a cure to focusing on quality of life.
It absolutely is.
Yeah.
It requires a lot of sensitivity and open communication.
Right.
But it's important to remember that palliative care doesn't mean giving up. It's about providing the best possible support and care for the patient, regardless of the stage of their disease.
So it's about empowering patients to make choices that align with their values and priorities. Are there any specific treatments that are used for advanced NSCLC, even if the goal is palliative?
Yes, there are. Chemotherapy can still play a role in shrinking tumors and controlling symptoms.
Okay, so chemotherapy isn't off the table just because the cancer is advanced.
Right. And we also have these amazing new weapons in our arsenal, targeted therapies and immunotherapy.
Right, we talked about those earlier. They're revolutionizing how we treat cancer.
Yeah.
Can you give us a quick refresher on how they work?
Of course.
Okay.
Targeted therapies work by homing in on specific vulnerabilities in cancer cells,
Right.
like those driver mutations we discussed.
Right.
They interfere with the signals that tell cancer cells to grow and divide, essentially putting the brakes on tumor growth.
So they're like guided missiles going straight to the source of the problem.
Exactly. And immunotherapy takes a different approach. It essentially trains the body's own immune system to recognize and attack cancer cells.
That's incredible.
Yeah.
So even in advanced stages, there's hope, and there are treatment options that can make a real difference in patients' lives.
Absolutely. Now let's switch gears and talk about SCLC.
Okay, let's talk about SCLC. You mentioned earlier that it's a very aggressive type of cancer.
Yes, SCLC is known for its rapid growth and tendency to spread quickly.
Right.
But the good news is it's also highly sensitive to chemotherapy.
So it's a bit of a double-edged sword.
It is.
How do we approach treatment based on the stage?
As we discussed before, SCLC is generally classified as either limited stage or extensive stage.
Right.
For limited stage SCLC, where the cancer is confined to one side of the chest, the standard treatment involves a combination of chemotherapy and radiation therapy.
Okay, and the reason for using both chemotherapy and radiation
Yes.
is to attack the cancer from multiple angles.
Precise. Chemotherapy targets cancer cells throughout the body, while radiation therapy focuses on the tumor itself,
Right.
shrinking it and preventing local recurrence.
So it's a comprehensive strategy, hitting the cancer both systemically and locally.
Exactly. And in some cases, for very early stage limited SCLC, surgery might even be considered, followed by adjuvant chemotherapy and radiation.
So there's a range of options depending on the extent of the disease. What about extensive stage SCLC?
Extensive stage SCLC, where the cancer has spread beyond one side of the chest, is more challenging to treat.
Right.
Chemotherapy remains the cornerstone of treatment, but the focus often shifts to palliative care,
Okay.
aiming to manage symptoms and extend survival rather than cure the disease.
So for extensive stage SCLC, the prognosis is not as optimistic.
Unfortunately, that's true. The survival rates for extensive stage SCLC are significantly lower than for limited stage.
This is a lot of information to process, but it's incredibly important to understand how the treatment approaches for lung cancer vary, depending on the type and stage of the disease.
Absolutely. And it highlights the importance of early detection and prompt treatment.
Okay, so we've covered a lot of ground on treatment.
We have.
But before we wrap up, I want to circle back to something we touched on earlier,
Right.
the psychosocial aspects of lung cancer.
I'm so glad you brought that up. The emotional and psychological impact of a lung cancer diagnosis cannot be overstated.
Yeah,
It's a life-altering experience for both the patient and their loved ones.
absolutely. Facing a diagnosis like this can trigger a whole range of emotions: fear, anxiety, sadness, anger.
Yes.
It's a lot to cope with.
It truly is.
Yeah.
And it's essential to address these psychosocial needs alongside the physical aspects of the disease.
So it's about providing holistic care, recognizing that the patient is a whole person, not just a collection of symptoms.
Exactly. Patients with lung cancer need support with coping mechanisms, managing side effects, navigating the complex healthcare system, and making difficult decisions.
And that's where a strong interdisciplinary team can be invaluable, right?
Absolutely. It takes a village to provide comprehensive cancer care.
It does.
Oncologists, nurses, social workers, psychologists, palliative care specialists,
Right.
they all play a vital role in supporting the patient and their family throughout their journey.
It's about creating a network of care, a safety net
Yes.
that helps catch the patient and their loved ones when they need it most.
Exactly.
Yeah.
And it's about recognizing that the psychosocial impact of lung cancer can be just as profound as the physical challenges.
Donna, this has been an incredibly insightful deep dive into the world of lung cancer.
Yeah, to have.
We have covered so much ground,
So much.
from epidemiology and pathophysiology to diagnosis, staging, treatment, and the psychosocial aspects of the disease.
Absolutely.
I'm exhausted.
It's been a pleasure unpacking all this information with you, Harvey.
Oh, likewise. And I hope our listeners are feeling more confident in their understanding of lung cancer, especially as they prepare for the MCCQE.
Me too.
But before we move on to the final section,
Okay.
I want to emphasize one crucial point.
Of course. What is it?
Remember, this deep dive is for educational purposes, not medical advice.
Right.
You should always consult with a qualified healthcare professional for any health concerns or before making any decisions about your health or treatment.
Well said. It's so important for future physicians to use this information responsibly.
Okay, so let's recap what we've covered today.
Okay.
We talked about the heavy impact of lung cancer, how it's a leading cause of cancer deaths worldwide.
Right.
We untangled that web of risk factors.
Yeah.
From smoking to radon to asbestos exposure. We even explored how certain lung diseases can increase risk.
Yes.
Right. And then we dove into that cellular chaos
Yes.
that drives lung cancer.
Those genetic mutations.
So genetic mutations, right,
Yeah.
that disrupt normal cell growth and lead to out-of-control proliferation.
Exactly.
And we discussed the importance of classifying lung cancer accurately using tools like the 2021 WHO classification because it guides treatment decisions and helps predict prognosis. Right. And then we tackled those often subtle ways lung cancer presents, from the common but nonspecific cough to the more alarming signs like hemoptysis and perineoplastic syndromes. We even navigated the maze of staging techniques from imaging to those more invasive procedures like bronchoscopy and mediastinoscopy, all aimed at figuring out the extent of the disease.
Right.
We explore the diverse arsenal of treatments available, from surgery for early-stage disease to chemotherapy, radiation, targeted therapies, and immunotherapy for more advanced cases.
Yeah.
We talked about how treatment decisions are guided by the stage and type of lung cancer, as well as the individual patient's needs and overall health.
Right.
And we wrapped up by highlighting the essential role of palliative care in providing comfort, symptom management, and support for patients with advanced lung cancer, emphasizing the importance of a holistic approach that addresses both the physical and psychosocial challenges of the disease.
Absolutely. It's been quite a journey.
It's been a journey.
We've covered a lot of ground, but it's knowledge that's fundamental for anyone aiming to practice medicine. Absolutely, especially here in Canada, where lung cancer remains a significant health concern.
Absolutely. So now that we've given you this solid foundation, where can our listeners go to delve deeper and continue learning about this complex and ever-evolving field?
Stat Pearls is an excellent starting point.
Yeah.
It offers a wealth of evidence-based information presented in a clear and concise way.
It's like a medical encyclopedia,
Yeah,
but much more engaging and user-friendly.
exactly.
Yeah.
For those who want to go even further,
Yeah.
there are comprehensive oncology textbooks that provide in-depth coverage of lung cancer.
Right.
A classic is Principles and Practice of Oncology by DeVita, Hellman, and Rosenberg.
And for a more focused approach,
Yeah,
the Oxford Textbook of Oncology has an excellent section dedicated to lung cancer.
definitely. And don't forget about the wealth of information available in medical journals.
Oh, right.
Journals like the Journal of Thoracic Oncology, Lung Cancer, and Clinical Cancer Research publish cutting-edge research on all aspects of the disease.
Excellent recommendations. Now, before we wrap up completely, I want to leave our listeners with a thought-provoking question to ponder as they continue their learning journey.
I love a good brain teaser.
Imagine you're a fresh out of med school physician, and a patient walks into your clinic with a persistent cough, unexplained weight loss, and a history of smoking. Given everything we've discussed today, how would you approach this patient?
Ooh,
What would be your next step?
that's an excellent question. It challenges our listeners to apply their knowledge and think critically about how they would handle a potential lung cancer case in a real-world setting.
Exactly. It's a reminder that medical knowledge is most powerful when it's used to guide our clinical decisions and ultimately improve patient care.
Couldn't have said it better myself.
Thanks for joining us for this deep dive into the world of lung cancer, everyone.
Thanks, everyone.
We hope you found it informative and helpful as you prepare for the MCCQE. Keep learning, keep questioning, and keep striving to be the best doctors you can be.